I treated a lot of breast cancer patients initially after receiving my lymphedema training, and I always enjoyed working with that population. You get a different sense of gratitude from working with them. Pain is scary, does it mean the cancer's back? Does it mean, what does it mean? And it's almost like you can see a weight lifted off their shoulder when they have that connection with you. Education and training is critical on a few different fronts. For patients, it's imperative that they know we exist, that we can help them thrive again after cancer treatment. Most of them, when they get to you, they haven't heard what you're telling them, the education that you're giving them, and it's very relieving what they hear you saying. They're getting very good knowledge and education about the treatment of their cancer from their medical team. Where we come in is being able to educate them about these functional issues. This extra educational knowledge is what helps get them over the hump and get those best outcomes possible. For therapists, they need to have that understanding of the cancer that the patients have, the treatment behind it, how that affects the impairments that they present with, in order for us to really truly be able to help patients optimize their outcomes with our care. We see the patient at time of diagnosis and begin finding baseline function of a patient to help prevent or at least mitigate the intensity of the impairments versus treating them on the back end. Until recently, much of the training in oncology rehab is more focused on a specialty. So, for example, lymphedema versus that comprehensive oncologic knowledge that helps you really gain a full understanding of what they went through for treatment or what they're going through for treatment contributes to the way that they present to you at that point. And there's just such a need to educate therapists in that to help achieve those best outcomes. Training never ends because the world of oncology and cancer is always changing, it's always evolving. It's important that therapists stay abreast of the latest techniques, the latest research, evidence-based treatment interventions in order to ensure that we're helping patients achieve the best outcomes.